Today we continue with our seizures and epilepsy series, talking about how seizures present. So the common way in which seizures present is what we all know: someone who's doing whatever they are doing, they fall down, start having those jerking movements, they pass stool, and they pass urine. Okay, so this is not the only way in which they can present. So let's start from newborns. In newborns, it can be quite difficult to tell whether a child is having a seizure or not. So usually things like twitching, things like boxing movements where they start moving their hands as if they are boxing, lip smacking where you just look at them and they're having these smacking lips, okay, or where their eyes start rolling backwards. All these can be signs of seizures in the newborn. So if you're not sure, take a video, go with the baby to the hospital and consult your doctor. Okay. Another common way in which seizures can present in children are what are known as absence seizures. This is where a child is in class or talking or playing, then all of a sudden they just freeze. They're not blinking, they stop talking for a few seconds, and then they go back to normal and continue like nothing happened. So this is very common in school-going children who are performing quite well in class. Then all of a sudden their performance goes down because they can't concentrate. The teachers start complaining that the child does not concentrate in class. They black out. You see, so that is known as an absence seizure. So go to the hospital if you have a child who's presenting like this. So another way in which seizures can present is by just those jerking movements in one hand or in one leg or on one side of the body. Okay, so there's also this theory of auras. This is where before someone has a seizure, they always complain to say they have some flashing lights or they smell something bad. Okay, that is known as an aura. So usually this signals that a seizure is going to happen either in the next few minutes, few hours, or even a few days. Okay, so this is just some of the ways that common ways that seizures can present. So when you see someone having a seizure, you need to act. And in our next video, we're going to talk about what you can do to help someone who's having a seizure, because that is very, very important. Even before you get to the hospital, there's something that you can do to help that person. So see you in the next video.